As part of National Pain Awareness Month that is focusing on back pain, I wanted to take a moment to talk about chronic low back pain. Now, hopefully this is something that most of us do not need to experience, and you listening to this right now hopefully will not experience. But you may, or you already may have chronic low back pain. And so I think there are a lot of myths around chronic low back pain, and perhaps it's an opportune time to really talk about some of those myths and develop a bit of a myth-busting approach to chronic low back pain. Now, obviously, the first thing to say is that it sucks, because when you do have persistent back pain, it's going to interrupt and intrude on a lot of things that you want to do in life. Going to the beach, kicking a soccer ball, playing with the kids, all those kind of things, even your work or going down and going out to a restaurant with friends. All those is overlaid with the fact that you're experiencing ongoing back pain whilst you're doing those activities. So obviously it's not fun, and that's why patients are going to look to get some treatment to see if it can be reduced or managed, for example. Now, when we think about chronic low back pain, there'll be some things that are serious, and they can usually be ruled out very early in the piece. They're things like tumours and fractures and other things of that nature, and they're usually very, very obvious. So once those things have been excluded by physicians or specialists, then what you're left with is a case of ongoing pain and sometimes no clear reason for that ongoing pain. And generally what we're going to do then is be recommending a management plan. And I think really the key is that the patient has to be the one who develops the management plan in concert with their medical providers to develop that. It's really the patient who ought to take charge, not the patient sitting there and waiting for something to be given to them. That doesn't work as well. So when we're talking about a management plan, what do we mean when we talk about that? I think we're really talking about two aspects. One aspect is, can my pain be reduced? And if so, how? And then the second component might be, if my pain is going to be ongoing, and that's kind of what we mean when we say chronic or persistent low back pain, how can I best manage my life in the presence of some degree of ongoing back pain? Now, it turns out most people think that surgery is going to be needed for their chronic low back pain. Now, at the moment, surgery doesn't have a large role to play for that particular condition. There can be certainly a role to play for surgery to relieve trapped nerves causing sciatica going down the leg. That's a very successful operation. But we see less success when it comes to other issues related to just back pain and back pain only. So we're often talking about an assessment process that will occur typically by seeing a pain medicine specialist physician in a pain clinic, for example, and they will want to really understand all aspects of the back pain. They'll want to understand when you have it, what makes it worse, what makes it better, what you've tried before, and the character or nature of the pain. They'll look at any scans that you may have had as part of that process, and then they'll develop a plan about what they think might be going on, and if there's any direct treatment as regards that. And sometimes there is, and sometimes there isn't, as part of that process of having gone through that diagnosis. If there is, then we'd be looking at physical exercise to actually strengthen the back muscles and hold the spine in better alignment and reduce pain, as well as reducing the concern and threat level that often causes people to want to lie down and rest or take opioid-based painkillers that we know at the end of the day are not helpful for chronic low back pain. So we want to avoid the things that make the condition worse. In addition, we can see if there are particular injections or interventional procedures that may be helpful. Sometimes there is, and sometimes there isn't. But above all, it's going to be a management plan developed by the patient in guidance and consultation with their medical practitioners to help them through the process of living a quality life with their pain. And that's where the psychologists come into play to assist in that process. And if your doctor refers you to a psychologist because you've got back pain, it's not because he's saying you're crazy. It's saying, I know somebody who's got some special skills that can help you work through each day when you've got pain. So that's a little short summary of some of the things that can be useful for managing a life if you do indeed have persistent back pain.